What's up, y'all? Welcome back to In the Wild. I'm Rayshawn, and for today's episode, we have a treat for you because did you guys know that nearly 60% of the healthcare industry is built by allied healthcare professionals? So for today, we are going to talk to some of the professors and faculty, program directors from the different departments that make up our College of Allied Health Sciences, and really just kind of see what they do. But since it's a special time of the year and it's actually Allied Health Week, we are going to talk a little bit more niche for this episode. So allied health professionals do so many things for so many different people, and part of that care is taking care of those who may have a cancer diagnosis. So for this episode, not only are we going to talk to these allied health professionals and faculty, but we're also going to talk about how they in particularly treat people with cancer, because that is a disease that has touched and affected so many people. I'm sure you know someone who may have been diagnosed and has been treated for cancer. So we're going to talk to them and see how they prepare our students here at Augusta University to heal and treat that population of folks. So get ready, because here we go. Nicole, Lauren, thank you so much for being here. Welcome to In the Wild. This is your first times both on the show. We're talking about a really interesting topic today. But before we get into that, do you mind just introducing yourself to those listening and I guess just share a little bit about your role here at Augusta University?
Sure. Well, I'm Nicole Moore. I'm a registered dietitian and assistant professor and program director of the Master's of Science in Allied Health with a concentration in nutrition and dietetic internship program. So I make sure that everybody who comes in to our graduate program not only gets their master's degree, but also gets the accredited supervised practice that's required in order for them to be able to sit for the credentialing exam to become a registered dietitian.
Oh, nice.
My name is Lauren Horton. I am one of the full-time faculty members for the radiation therapy program. I am one of the assistant professors for the Augusta campus. We also have an Atlanta campus, but I am a faculty member for here at Augusta campus. We help get students ready to prepare them for their board examination as well.
Mm-hmm.
They take a national exam to become registered radiation therapists so they can work in different cancer clinics across the United States, as well as they receive a bachelor's degree in radiation therapy.
Yeah.
How did you guys both choose your respective fields? Like, how did you know, like, you're in the right area of practice?
Well, for me, I went into undergrad and really thought that there were three pathways. In health, I did want to go into health sciences. I was very interested in that aspect, science, and then helping people and combining that. And I figured you can either be a doctor or a nurse or a pharmacist, because I went to UGA. And then I'm getting in and I'm training and I'm like, you know what? I'm more interested in reading about how food is affecting things, how nutrition can be implemented. And a friend of mine happened to be a dietetics major, and she was like, you ask all these questions and you look all this stuff up, you can major in that, right? And I was like, what? And so I met with faculty in the dietetics program and fell in love with it and have been doing it for a very long time.
That's awesome.
Yeah.
For me, my mom actually got diagnosed with cancer when I was a senior in high school, and I went with her to her cancer treatments, and one of the clinics let me watch, and they were like, I fell in love with it, and I was like, oh my goodness, I would love to use her story to help other people like her, and so yeah, I kind of started then, and I came straight here to AU and graduated from this program, and now I'm back to teach, but that's what got me started.
That's awesome. What was it like to come back here to help train, the next generation of students?
It's such a blessing, and it's been such a fun journey. I've only been working here now a year and a half, but it's been wonderful seeing how much it's grown since I was a student. We had 7 in our class, and when I started, and now we have over 13 per junior and senior class, so over 20-something students. So we are growing. We have now a distant campus, so watching the opportunities that we now are able to give the students to help them learn is nice, because I'm like, I wish I had that when I was in school. So it's really nice to see that they are still investing in this program, and that it's continuing to grow and give the students lots more opportunities. So
yeah.
I've loved to see that.
Yeah, I think training has changed a lot. I know since I was in school, the opportunities and the things that Augusta University has to help train students, like our high fidelity simulation lab, the lab equipment we have like in our program, the hospital right there at an academic teaching facility. And there are so many clinics and being in a medical district and having so much opportunity here, it's just, I mean, it is. It's so much more than I know what I got when I was training. So it's really great to be here at Augusta University and watch our programs grow.
Yeah, I was talking on the show with one of my friends who's a graduate and now faculty at the College of Nursing, and she was kind of saying similar things of like, yeah, back when, we were students, there were things that, they have now that we didn't have, which is really cool to see the growth, especially in like a relatively short amount of time for the university.
Oh, yes.
Yeah.
So for those who are just kind of unfamiliar with these fields, can you talk about some of the different like career paths and opportunities that students may have if they choose to study nutrition and dietetics or radiation therapy?
Sure. So a registered dietitian is a food and nutrition expert whose goal is to help people to live healthy and active lives through the transformational power of food and nutrition. And they can do that by doing medical nutrition therapy individualized with hospital patients or in clinics or like nursing homes or community centers. But they can also work on a broader level at a public or community-based nutrition interventions and programs to get people to eat healthier. We also work in food service, so we both manage food service operations or consult with food companies and suppliers and distributors and then like restaurants or the cafeteria and the hospital to get that healthy food out. But we also do research and communications, to get the word out about nutrition.
So ours is a little different. We are a little more niched than that. We are a form of treatment modality for different types of cancers, and we can treat some benign conditions as well, but 99% of our patients do have cancer. We can work in hospitals. We can work in outpatient clinics. There's becoming a new trend in dermatology where they're hiring radiation therapists to just work in dermatology offices. And so you're only treating skin cancer. So there's lots of opportunities. Georgia has lots and lots of cancer centers, lots of radiation therapy centers. We have around 6 locally within like an hour and a half distance from us that our students get to train at as well. And most of them end up employed at these locations. So they end up just staying after graduation and working there. We also have the opportunity, some of our students have worked at veterinary clinics and done radiation therapy on animals. And also sometimes you can go into radiation safety and protection. I know a few people who've gone to Plant Vogel, SRS, and gotten jobs out there with radiation safety as well.
That's pretty cool.
Yeah,
That's cool.
Lots of diversity, a little bit.
For someone who's not like in healthcare at all, like that's really cool to hear the different opportunities that you may have, because I want to say the average person may think very singularly when it comes to the work that y'all do.
Yes.
And I guess just diving into like the theme of today, which was, the different areas that you guys work in and how they support those who may be diagnosed with cancer, have cancer. So I guess starting with you, Nicole, like what does that look like for a registered dietitian?
Sure. So a registered dietitian is going to perform medical nutrition therapy and develop those interventions that are going to help patients to tolerate their treatment and to mitigate some of those side effects. So we can help people. You don't necessarily want to eat. Sometimes you have upset stomach, diarrhea, constipation. There are consequences of radiation therapy. Like if you have radiation in your chest, it can, kind of burn. Feel like the esophagus is burning, and so like swallow effect. So we want to make sure we're developing a good plan so that you get all of the nutrition that the body needs to heal itself and sustain itself, but also give a good quality of life. We don't want our patients to constantly be nauseous. So how can we adjust what they're eating or how they're getting their nutrition in order to, have a better quality of life? And it has been found that medical nutrition therapy can help patients to maintain or gain weight, prevent weight loss, decrease hospitalization, the length of time that people are hospitalized, and also survival. So nutrition is a powerful part of that interdisciplinary team. So you'll typically see a registered dietitian on the cancer treatment team.
That's awesome.
And then radiation therapy is one of the main treatment modalities. So we play a very big role in treatment of most cancers, along with medical oncology and surgery. Those are the main three treatment options that cancer patients have. So we play a very important role in that. The science and technology that's completely always evolving with radiation therapy is outstanding. Even since I was in school, started school 10 years ago. Now, seeing where it has evolved in the care and management of people's cancer and the curing of their cancer has been really wonderful. But we do work oftentimes so much with nutritionists. Radiation therapy involves all interdisciplinary care as well, because we, like she said, we definitely have patients who really need all of their help, and we need it too, and we have to work together to make sure that we're providing the best care for the patient so they can have the best outcome.
Yeah, absolutely.
What does that look like when you're teaching and training students and how to interact with, I guess, cancer patients in particular?
So we do trade. We actually go into the hospital and into the clinics with our students, so they get that firsthand experience. And so we do have to teach them like active listening techniques and interview techniques and empathy and kind of understanding where those patients are coming from. So we do a lot of interactions with counseling skills and again, I say active listening is a big one, motivational interviewing, to really make sure that we're treating the individual when we're working with them. So they get that direct hands-on working with real life patients, which really can't be compared to the simulations and things we do or out of a textbook. We do that too, but we do send them in with dietitians in the field and have them work with those patients.
And very similar. We our students start right away. Like they start in August, and they're right in clinic by Labor Day. So we immediately start them in face-to-face with patients and with other therapists. We do have some faculty members that also work at our clinical sites. So we get not only to teach them there, but we also get to teach them at the clinic sites. So we have that interaction. They also take classes just on patient care, patient management, how we're going to manage their cancer symptoms, how would you speak to their family, like what you can say to them, what you're not allowed to say to them. Things like that, that we have full classes on that. But again, nothing compares to actually being around the patient. And thankfully, our students get dove right in from the beginning. So they start immediately in clinic training. And the best way to learn, like she had mentioned, was in person and learning from others, seeing how other therapists interact with patients. I think that the most common misconception is that you have to coddle a lot of patients who have cancer, that you can't talk about it or you can't act like a certain way, but that's not what most of them want. I would say from my experience, they want you to act like it's a normal day, because for them, most of the time it is. They go to work, they come get treated, and they just they're trying to carry on with their lives. And so just trying to build those relationships and teach them it doesn't always have to be just their cancer diagnosis. And we teach them they are not their diagnosis. They are a person.
Yeah.
And to treat them like you would treat anyone else.
Yeah.
And I think you brought up a good point as well, of like you teach them how to talk to their families and like loved ones as well, because I'm sure that impacts.
It's a huge part of it. And as being the family member myself at one point in my life, it was important to have those interactions where it's still about the patient. But they are a big part of that. Like patients' loved ones are a huge part of their healing and their journey. Because if without that support system, some patients don't do as well. The patients that have the support and the family that's there with them, bringing them to treatment, it makes a big difference. So learning how to manage their family and the family's expectations and the patient's expectations are so important when it comes to cancer treatments.
Yeah. And I would definitely agree with that. Both the support network, and then thinking about for nutrition, how much food is a part of our lifestyles. So if they have to change how they eat, or they have to eat different foods, or they make things a little bit different, having that family support and knowing that they're there, they're helping them, they understand what's going on, that makes a big difference, because we are impacting a huge part of their life, both with their diagnosis, and then if we have to affect what they eat too, that's kind of like a twofer. So we have to, kind of have more of that support group.
So as faculty, have you guys, I'm sure you probably have, like been able to witnessing like aha moments working with students of like, okay, I taught them this and they may have been nervous or, had some, feelings about going out and to interact with patients, and, there's that aha moment after they've done something really well, or I don't know.
Oh, no, definitely. I think it happens very soon after we go ahead and start sending them out and talking to patients. And we kind of, back off a little bit and let them answer those questions. And you start to see that confidence being built. Because for us, our students have come in with 4 years of education. They already have a bachelor's degree. So they have all this knowledge and training, and we try to, reinforce that as they go in. But once they've talked to a patient and they've explained something, and you kind of, for me personally, when I hear kind of some of the same words that I've been giving them, and they come out with that and they're like, okay, they're like, how did I do? And I'm like, it was perfect. And you can watch that confidence just build over the 21 months that they're with us in being able to explain things and get that change. Or if they go in and work with a patient and say, they agreed to, this plan that I thought of, and I'm very excited. And then they go back and it's like, and they got better, it worked. That's amazing. Yeah.
Yeah, same. I think that seeing our students put together what they learn in the classroom and applying it to their interactions with patients really is just, it's a full circle moment. It's like, especially when you get to their senior year for us, seeing them become therapists is really, really just so amazing, just watching them, because we are training people to take care of people. And I always tell them, like, we are training you to take care of family members and someone else's mom or someone's dad or their child, or you're training is such an important calling and such an important job. And so seeing them fully develop into a full therapist and being like, you're ready to like go off and fully do it is such an amazing thing to watch and witness them grow from little baby therapists to like ready to take on the world and help find cures for cancer and do all the things. So it really is a rewarding thing to see, and I enjoy seeing them every year graduate and get ready to take on whatever life brings them. So.
Yeah. Definitely. And I've been doing this for just a little bit longer. And even one of my graduates actually works in oncology. She works at the Georgia Cancer Center. So like seeing her like in action. I have graduates in the hospital and other clinics too, but just knowing that, they're out there and then they're helping to teach our current students.
Right. Yeah.
So that is just amazing
really
to watch that just keep going, keep just everyone educating everybody and growing and learning. And I think that's what's really exciting.
Yeah, that does sound like very fulfilling.
Yeah.
And I feel like with, health sciences, technology is always advancing. So in terms of how you teach and train students, are there any like cool innovations that we're using right now to help teach our students?
So I think for us, using the simulation lab, the high fidelity simulation lab has been, and our mannequins, so they can, have an interaction in a safe, like almost a very safe place. So we can mock up that interaction of, especially for our students who may not really have spent a lot of time in a hospital room. So they can get used to where are the, IVs and what are the tubes coming out, and there's wires, because we do have to do an exam. So there is, maneuvering around that type of thing. And it helps to get the jitters off that they can see themselves interviewing. You can tell I'm already like a little bit with my hands. Well, I found when I recorded myself, when we started it, would have my hand in my lab coat pocket and I'd be talking and you could watch me like swing my lab coat like this. And, it's sometimes those little things, like we have students who click pens when they're nervous. So they're like talking to the mannequin and clicking. So they can kind of tell, they can see this, but they can also see what worked well. They're like, I really liked the way I explained that or the way I did that. And then just the opportunity to kind of mock up things like placing, enteral feeding tubes or seeing how, swallow works. We have more of that through technology and imaging and computers, which is very exciting.
That does sound really cool, especially being able to watch yourself and how you interacted with a mock patient.
Yeah, yeah, and they do it for, you can do it for all kinds of things where you do go back and then you talk about it. So you get my feedback, the other students can give some feedback and be like, here's the little thing I saw, or, I loved the way you explained that. So they're also learning from each other. And so they're kind of learning that role of precepting, which is another goal of ours, is that we're going to send them out, they're going to work in the hospitals or clinics, and they're becoming preceptors for our students so they can help to explain and teach not only our patients and families, but also our students.
I love that.
Yeah.
For us, we actually just got in 2023, beginning of summer 2023, we got a state-of-the-art VERT machine. It's actually like a big box, and it actually simulates a real linear accelerator, which is what we use to treat. So our linear accelerators are cemented into grounds. They're about 8 to 10 feet tall, weigh thousands and thousands of pounds. So it's not like I can just bring that to campus, especially because they produce radiation.
Right.
So the simulation is it's fully virtual machine, but it actually has the pendant that we actually use to maneuver a real machine. It matches a real machine. So our students can learn on how to move our gantry, how to move to get into certain patient positioning, how to read measurements. We have all of that available through this new simulator that we were given. And so we're very thankful for that because it has been a huge changer in how we teach. So we just had one full class, so one full year of teaching with this VERT simulator, and it has changed dramatically. I think they get more hands-on experience, not just in clinic, but also in their classroom. Yeah. So you're able to actually put it into teaching as you teach. So before I would teach, and then they would go to clinic and have to remember what I taught, but now I get to do it simultaneously. And so it's really nice to be able to show them how our angles work. We're very physics-based science, so understanding how divergence of the beam and how the beam is going to enter and exit is super important. It's such a great thing that we have to offer to them now that we didn't have until a year ago. But also we also use the Interdisciplinary Simulation Center. We use it for CPR. Oftentimes you don't hope you have to use it because we're an outpatient service, but just getting them those skills and getting comfortable with the chaos that comes with needing those skills really helps them feel more comfortable when they actually go into clinic, that they're ready.
Right.
That does sound really impactful to be able to have that device to really help train them to this is exactly what you're going to be using when you get out there.
Yeah.
For any students who may be considering studying either of your programs, what would advice or tips would you give them if they're considering applying?
So I think one of the big experience is experiencing it, actually volunteering in a hospital or a clinic or with a dietitian and see what you're getting into, see where you might fit if you like it. Volunteering and work experience is a big part of the application for us. We do want to see that they have gone and done. They've kind of done it before they come to us, because I think that's really important to show the passion, and really think about why you're doing this. We're very people-based care. So, your interaction with people, what is your, driving factor that makes you want to become a dietitian is also really important. So that passion is something we look for.
Some very similar things. Because we're a bachelor's program, we don't require job shadowing hours or anything, but we do think that it makes a huge difference when students come in ready and understand what we do. Understanding that we're not like a chemotherapy infusion. That's a common misconception. Also, common misconceptions, I think we take just bone x-rays all day. That's a different program. So we treat cancer patients. So just making sure they have a full understanding of what our program is and what radiation therapists do. We do offer lots of those resources on our websites, like Day in the Life of a Therapist, just to kind of show them and have those resources available for students who maybe don't know what radiation therapy is for, but really focusing on math and physics and working on keeping those GPAs up for math and science is something that we really value, and because it is a physics-based science, so we want to make sure they're able to do the classwork without being overwhelmed. But I think those, and then the passion, we are very people-oriented, so understanding that it's a big calling to be a radiation therapist. You do work with sick people who are, some have, don't have a full life expectancy, don't have curative treatments, so we're just treating them for palliation, for pain management. So understanding that you're taking all of that on, and that's a big thing to take on, especially we have a lot of younger people. I mean, I was 20 when I got in the program, so like it's a big thing. So just understanding it's a huge thing to take on, but when we get those students that they know and they're ready and they feel called to do it, it's a wonderful thing to see.
Yeah.
Well, thank y'all so much for being here, and thank you for the work that you do to help train our students to be the best in all that they can be.
Well, thank you for having me.
Thank you for having us.
Meet Augustus, Augusta University's chatbot designed to make your life easier. With Augustus, you can get instant answers to all your questions 24/7 right at your fingertips. Wondering where to refuel between classes? Just ask Augustus about dining options at our campuses. Feeling FOMO? Never miss out on an exciting campus event again. Augustus keeps you in the loop of all the must-attend happenings. Need a lift? No worries. Augustus can help you find shuttle schedules and routes so you can breeze through campus without breaking a sweat. Questions about tuition payments? Don't stress. Augustus can help you with financial aid and payment options, ensuring you stay on track without the headache. Feeling overwhelmed? Remember, your wellness matters. Reach out to Augustus for support and resources on maintaining your mental and physical health during your time at AU. Download Jack Mobile and start chatting today.
Welcome you guys to In the Wild. Lori, Pam, Patricia, thank you so much for being here. I'm super excited to continue our conversation. Earlier we talked to Nicole and Lauren about their programs, and I guess to kind of start, same question to get started, do you mind just telling our listeners a little bit about yourselves and just your role here at Augusta University?
Okay, well, I'm Lori Prince, and I've been a health information professional now for almost 30 years. And I've been in Augusta. I did my training here, and this is probably one of the best decisions I ever made, was to become a health information professional. And what else do I need to say? I just don't know.
Yeah, just a little bit more about your role here at AU.
Okay, well, I'm the program director for the Bachelor of Science in Health Information Administration, and it's just one of those hidden jewels in healthcare. You don't hear a lot about it because you don't see us directly with patient care. We're that behind the scenes kind of career, and it's easier to know that we're there than to know that we're not there. When things get messed up, you know we're not there. How about that?
That makes sense.
Okay. I'm Pam Kearney. I'm an occupational therapist, and I am the department chair for the Department of Occupational Therapy here at Augusta University. I'm also program director. We have a Master of Health Science in Occupational Therapy program here that has been at Augusta University for over 50 years. It's the oldest one in the state of Georgia, and we're very proud about that. And now I don't know what else to say. And I've been here at Augusta since 2013. So I was teaching in another institution up in Philadelphia, moved down for a faculty position, then moved my way up into leadership in the department.
That's awesome.
I'm Patricia Watford, and I'm also an occupational therapist, and I'm in the Department of Occupational Therapy. I'm an associate professor, and I've been at AU for 5 years now, and super happy to be there.
Awesome. Thank you guys again for being here. And I guess for another just question for all of you guys, what are some of the different career pathways that a student could have if they were to choose to study in your respective areas?
Well, what's nice about health information is that you're not pigeonholed into one little thing. You don't have to work in a hospital. You don't have to work in a physician's office. The entire healthcare setting is your workplace. Most of my students and graduates work remotely now, where we used to be, in facilities, but now a lot of them are at home working. Our program is even online, and we've been online since the year 2000.
Oh, wow.
It's been that long. We
really cool.
started the distance education program here at Augusta University. We were MCG then. And you can go into a couple different tracks in health information. You can go into the business side, you can go into the data science side, you can go into the systems side, or you can do the higher administrative things like compliance and regulatory things. So, the world is your oyster. It just depends on what you like and what you want your niche to be.
That's pretty cool.
Yeah. And I would say, OT is similar. The beauty about being an occupational therapist is we can work in so many places. We work with newborns through older adults and end-of-life care. We work in hospitals and schools and communities in long-term care. Anywhere, as an occupational therapist, what we do is we work with people who are not able to engage in the activities that are important or meaningful to them for whatever reason. Maybe it's a child who is born with some developmental delays and needs work to be able to play like other children do. Play is what kids do, or to be able to sit in school and class and sit at the desk and listen to the teacher and take notes and pay attention. Or somebody who has acquired a condition like a spinal cord injury or stroke or arthritis who's no longer able to do important activities. So OTs work in all kinds of settings and work across the lifespan, and that's the beauty of being an occupational therapist, because it's so diverse. There's so many things you can do with your degree in OT.
Patricia, did you have anything to add on to that?
No, I think Pam said it very well. It's a very diverse field. You can pretty much do whatever you want. I have a friend, her husband is a builder, and she works with his clients doing aging in place. So she designs homes around people aging, and that's how she uses her OT degree. So there's so many different things we can do, all the way from, like Pam said, NICU to hospice. We can do it all.
That's really cool. And the theme for today's episode has been just how allied health sciences supports those who may have been diagnosed with cancer. And so I'm curious as to how, and just once again in your areas, how do you just interact with those who may receive a cancer diagnosis?
Well, what's really interesting is there is a career pathway in cancer registry work that you can get as a health information professional. In fact, that was my very first job when I graduated.
Okay.
I was it used to be called a tumor registrar, but now it's a cancer registrar, and you can actually earn a credential in that as well. And you can work at the various cancer centers and the CDC and places like that, because you are the one that manages the information and the data that comes out of that cancer patient's condition. When you're doing the coding, you're doing the abstracting, you're doing the annual reports, you're doing the trends and the analysis, and you're looking at all the things that happen with that particular patient and putting it all together. So it's pretty neat.
I think with occupational therapy, when people receive a cancer diagnosis, that can really disrupt their ability to engage in their daily routine, their activities of daily living. So occupational therapists can be involved in working with folks with a cancer diagnosis, whether they've been hospitalized or receiving outpatient care. Maybe they have lymphedema as a result of breast cancer surgery, and OTs are working to maintain range of motion and to manage the edema that's associated with that. Maybe there's memory problems or cognitive problems, either because of treatment or because of the after effects of the cancer diagnosis. So, OTs can really be involved in working with folks with cancer anywhere in the healthcare continuum, and even beyond that. So our department offers a program called Camp Discovery, hence the shirts, that is geared towards, we've run it twice now. It's a 1-week program in the summer that's intended for women who are anywhere in their cancer journey. So women who are cancer survivors. We've had women who are participating who are relatively newly diagnosed, and we've had women participate who are years past in remission. And what we know about cancer, and women in particular cancer, often that process of treatment results in a narrowing of their engagement in meaningful activities, and that doesn't always recover after their treatment or after they are beyond their cancer medical journey. So we have been offering this program to provide women who are cancer survivors an opportunity to engage in activity with other women and develop that community and that support system for each other, and hopefully improve quality of life and improve their participation in meaningful activity. And we have a research study wrapped around that as well. So we're looking to measure those outcomes.
That's really cool that there's an entire program for women to go through that and have that support. I'm also kind of curious, are there any other opportunities, even with health information, that whether students or people could just like engage more with for your areas?
Well, usually you can have shadowing opportunities in a tumor registry. It comes with a little nugget of consent. You have to consent that you will not, divulge any patient identification and things of that nature. But a lot of times they can redact the records, and you can see exactly how that patient has progressed through their cancer diagnosis and treatment. And you will see, how their journey began, where they are now, how they've been staged, and see, what their prognosis is, all on a computer screen. So it's pretty neat. And if you can get that shadowing experience so that you can see, how that analyst takes that record and abstracts it and pulls out the pertinent data, it's really interesting.
That does sound really cool.
It was fun. That's been, besides teaching, that's been the most just enjoyable job that I've ever had.
Could you ask the question again?
Yeah,
I'm sorry.
No, you're fine.
I was so listening to what Lori was saying, I wasn't.
Yeah, I was just curious about any other experiences that students or just those interested may have with occupational therapy, like Camp Discovery. Like outside of that, are there any other cool experiences that you provide folks?
Well, we have a lot of opportunities for students to kind of explore the different areas of occupational therapy. So we have 4 level 1 field works, and that's where the students go out and have clinical experiences. And then we have 2 level 2 field works, which are a little more intensive. They're 3 months, 12 weeks in length for both of them. But we have some interesting international fieldwork experiences where students can go to Jamaica, and we spend a week there, and we work with children who are actually people across the entire spectrum of ages who have disabilities, and we work with them and work with the people who care for them as well. And then we are also adding a new international fieldwork. We're going to be going to Rwanda.
Oh, wow.
And Pam, do you want to speak to that new program?
Well, the Rwanda program, I don't know if I can speak about that so much. It's a new program. It's going to run in the spring, and they're going to be working with an organization in Rwanda that is also providing health care. And I believe that they'll be helping to set up some like therapeutic programming, therapeutic services as part of the community or the organization that they're working with. And I would say, Camp Discovery is a fieldwork experience. So students faculty are working with students, but they've developed many of the activities and are leading several of the activities for camp. And I think in our program, we have lots of those kinds of opportunities where we are either going out into the community as part of the learning experience or bringing the community into the classroom. So students in our program do have a lot of opportunities to get out there and experience the profession while they're in school.
I'm curious to know, like, what is it like after you've had those trips, whether it's like for Jamaica, I know we haven't been to Rwanda yet, but like once they come out of that trip, like what did they say? What did they talk about of how that experience may have impacted them?
Yeah. So our partnership with Mustard Seed Community in Jamaica, that's our community partner. We have been involved with them since the fall of 2013. And pre-COVID, we were going twice a year. So we've had many, many trips to Jamaica and to Mustard Seeds. And for students who go, it is a significant learning experience. I hate to say life-changing because that just seems like too grandiose, but that's what the students will say. The students will say that it's been a life-changing experience. And I think for many reasons, I think, seeing the impact of, or seeing cultural differences in how people with disabilities are able to experience life, having that experience of being in a environment that's very foreign for students, and where they're really forced to step up. They're forced to be creative. They're forced to respond in the moment because they don't have all the resources that we have here to fall back on. And then just the residents that we work with there are great. They're just amazing. And we have a lot to learn from them and from the care team that's there.
Mm-hmm. And we had a health information student that during the summer between her junior and senior year actually went to India and taught coding.
Wow.
And came back with just rave reviews, and she was actually offered a job to go back over and teach permanently. We've also had another instructor that went to Saudi Arabia and taught.
Cool.
And, again, the world is your oyster in health information because everyone has information. You generate information the minute you step into a health facility. So, you've got to learn how to manage it, code it, bill it, make sure it syncs, have interoperability, the whole 9 yards. And to do that, like Pam said, in a foreign environment takes a special skill that sometimes you don't know you have. And once you figure out how it's done, the people are so grateful. They just can't believe, how much you've done for them. And all you did was literally flip a switch. But to them, it was life-changing. So it's really neat.
How does that make y'all feel as faculty when you see these students having these, I'm going to say, life-changing experiences, but I think it is like those experiences that really will impact them and they'll carry for the rest of their lives. What does that feel like for y'all?
It feels great, and it really makes me know that what I do makes a difference. And that particular student that went to India actually took her health information degree, went to law school, and is now a risk management lawyer. So she still uses her health information, but now in her law practice. So, again, that's another avenue you can go with HI, and it's amazing what you can do. And the impact that we, sometimes as faculty, don't know we give our students. But, then they write us and say, well, this is what I'm doing. And it just makes you feel like you make a real difference in their lives. And you help them build their career.
Mm-hmm. Yeah, I would agree. I think, when I think about working with students, our students are entering a profession that I care very deeply about. Mm-hmm. I've taught for a long time, but at heart I am an occupational therapist, so I want them to be excited about the profession in the way that I'm excited about the profession. So I think that we do look for those moments where they have an experience that really it all comes together, what we're learning in class all comes together, or we have an experience. And this happens when we go to Jamaica, particularly if we go in the second semester. We're a six semester program. They are with us on campus for a little over 4 semesters, so second semester's early. But they'll go and everything will still be new. They're still learning about how to think like an occupational therapist, and then they have this experience and things start to come together. And then they come back to campus and they continue to learn, and so that they have that experience of pulling it together in the moment, but then being able to reflect back on that moment as they continue to learn in the program. So, and that's it's always wonderful when students are able to say, "Oh, now I get it," or with Jamaica or camp, or when the students are loving the experience and the residents and the participants as much as we love the residents mm-hmm. and the experience and the participants, and that's all. So, that's what fills me up.
Yeah, and it's so much fun going to Jamaica with the students, and they're a little nervous. Some of them have never been on a plane before, and we get over there, we get to Jamaica, and they just flourish and they just blossom, and it's so rewarding to see them turn into the occupational therapists that you knew they were and they could be. And just to watch them blossom and watch them grow during that week is just, it's a wonderful thing.
What would you say makes just a great person for your respective programs? Like, what makes a great health information professional? Lori, I'll start with you.
You need to be detail oriented.
Okay.
Because we work with such data sets that they all kind of start looking alike, sounding alike, but you've got to make that distinguishing difference between them and make it all work. So you have to be detail oriented. You have to be disciplined because, like I said before, a lot of our students, graduates now, work remotely. So you have to be disciplined. You can't just sit at home and do laundry and cook and think you're going to make your quota for the day. So you have to be disciplined and know that you have to be there when you're supposed to be there and work like you're supposed to work. Anyone that has an interest in the data sciences, beautiful, we love you. Anyone that really loves the thought of working with a patient, but they don't like the blood and guts, come on, we have something for you. So I call us the nice, nasty profession because we read and see all the nasty. We don't have to touch it. So it's really nice.
You put that. And what about you guys? What makes a great occupational therapist?
I think that, so I talked about how diverse the field is, so I think what makes a great OT can be very diverse as well. But, at heart, you have to care about people and be a people person. And that does not mean you have to be an extroverted people person. You just have to be a people person at some level because we are working with people. And when we are working clinically, we are often working with people at one of the most challenging moments in their lives, and we're working with them very intimately. If I'm working with somebody to be able to shower again, or I'm working with somebody to be able to get dressed again, or to be able to care for their child, like that's really personal, intimate experiences with clients. So it has to be a person who wants to do that and is able to do that. And creative, we are working with people to help them get back to what's important to them. And every single person is coming to us with their own way of doing in their own environment, and what works for one person may or may not work for another. We might need to change that to better fit this person that we're working with today. So I think being creative, being we're creative problem solvers and wanting to work with people.
Yeah, I would agree with everything Pam said. Compassionate, I think that's number one. I think you need to be a compassionate person. I think you need to know how to deal with people because, like Pam said, there are going to be situations where maybe they're not in the best mood or maybe they're not feeling well, and you need to learn how to work with them so you can keep them moving in the direction they need to be moving. Creative is definitely a plus. We really need to use creativity in what we do. And I think someone who genuinely cares about people, I think that's the most important thing. You can have a lot of different personality traits and be a good OT, but as long as you really care about the person, I think that's the most important thing.
And what are you about to?
Well, I was going to say even like OTs who go into research, it's based upon that caring about people and wanting to, even if they're in the lab, it's about how do we help care for the folks that we work with as OTs. So.
And going off of that, what would you say to any students who are considering applying to your programs or coming to school here to study, whether it's health information or occupational therapy? Like, what advice would you give them to be successful?
Well, do as well as you can in your sciences, of course. We're looking for someone who can critically think. So you need to have good grades, of course, and you need to be able to have good time management skills. There's a lot of information that we have to give you in 4 semesters, and so you need to be on top of everything. The best time to apply, of course, is early, even though we have a June 1st deadline. The earlier, the better. There are some things that you're going to have as far as prerequisites that you may not be able to get until the summer before, and we take that into consideration. So when we get your application, we know you've got A&P still out there, outstanding. We know that you're getting ready to take it in the summer. You'll be done with it,
Right.
and you'll be ready to go in the fall, because we only have cohorts that start in the fall semester. We're not an open enrollment kind of program. So you have to apply and be accepted. So apply early.
I'd say for OT, we are a full 2-year program, 6 semesters. We start May, so applications open up the summer before July 1st, the year before that you come to the program. We accept students at 90 credits, so I think that's important. Anybody who's an undergrad who knows they want to be an OT, you can apply your sophomore year as long as you're going to have 90 credits completed before the start of the program. We do have prerequisites that you need to meet. You have to have good grades, you have to do well on the GRE, but I think just as important is we do require observation with an occupational therapist, and I think that's so critical because that allows applicants to know that OT is what they want to do. And I recommend that students do observation, spend time with more than one OT and more than one practice area. OT as a profession is so diverse, and you might spend time with an OT and be like, I don't know if that's what I want to do, but then you go to another area of practice and you fall in love with what they're doing. So I think, doing your research and understanding to the best that you can what OT is, where we work, the kinds of different work that we do, as well as getting those experiences and then getting the prerequisites and doing well. We do not care what your undergrad major is as long as you have the prerequisites. So when I'm talking to high school students, I tell them major in what you love and then get the prerequisites if you know you want to be an OT.
And the other thing I want maybe the listeners to know is that we have a part-time program.
Oh, okay.
So, maybe you do have a couple of outstanding prereqs. It doesn't mean you can't start. You can start part-time. And we have 2 formats. So you can be a face-to-face campus student, or you can be a 100% online student. So you've got options with HI. So if you think you're ready, please apply. We'll look at it, figure it out, and we can better tailor your experience so that if you need to be part-time, you're part-time. And we don't have any problems with our part-time students getting jobs. They get the same skill set that the full-time people get. It just takes them 6 semesters instead of 4.
That makes sense. Thank you guys so much for being here and talking to me. And I can't wait to hopefully have you guys come back on the show to talk about some more stuff in your neck of the woods.
Okay, great.
Thank
Thank you.
Well, I hope you guys enjoyed that episode. It was very enlightening for me because, as you guys know, I am not a health sciences person. Although I've always been fascinated by science, that's just not part of my wheelhouse. So it was really cool to learn about all the different ways a registered dietitian, nutritionist, or occupational therapist, or health information professional, radiation therapists can really just touch so many lives in so many different ways. So even outside of cancer in particular, like if you want to study any of those fields, you clearly have so many different options in front of you. So whether you are someone in that program or someone who's considering a part of that program, I hope you took something away from this episode. I certainly did. I love to learn, so I learned a lot in this episode. And tell us what you learned. Tell us on our Instagram at In the Wild Pod of what you learned in this episode. If you liked it, like, subscribe, do all those things. And until then, I will see you guys in the next one. Go Jags!